Our next introducer is Dr. Andrea Bouzouki, who is major advisor to Ashley Sanderlin, who will give the presentation. Dr. Bouzouki is an associate professor in the Department of Neurology and Radiology. She received her MD from the State University of New York Health Sciences Center at Brooklyn, completed a residency in neurology at the University of Michigan, where she held a 2-year clinical fellowship in geriatric neurology. Since joining the MSU faculty in 2001, Dr. Bouzouki has divided her time between clinical care of patients, specializing in neurologic dysfunction of those over age 60, and research. The focus of her lab has been the exploration of cognitive function during the transition between healthy aging and early dementia. She is currently actively engaged in clinical trials with novel Alzheimer's disease compounds using non-imaging biomarkers to evaluate disease progression. Welcome.
Thank you. So then it's my pleasure to introduce Ashley Sanderlin. She is a final year graduate student working to complete her dissertation using both patient data from my lab, which, as mentioned, studies cognitive disorders in a geriatric population, and from a national data repository of brain imaging in seniors called ADNI. Since Ashley's going to be telling you about her research work, I'd like to tell you a little bit about her other skills. Since arriving at MSU in 2011, Ashley has been an enthusiastic and talented teacher. She has been a teaching assistant in the neuroanatomy course for medical students, an academic coach for multiple undergraduate biology courses, a community workshop presenter on cognitive aging, and a facilitator for workshop sessions on leadership for graduate students. All of this enthusiasm and talent for teaching has culminated in her receiving a prestigious King Chavez Parks Future Faculty Fellowship, which means she was chosen as an especially promising underrepresented minority student on the basis of the experiences I've just listed, and her entire final year tuition and stipend were paid on the promise she has in the field of higher education. On a more personal note, it has also been my privilege not only to mentor her professionally, but to dance at her wedding and, most recently, attend her baby shower last month. So congratulations on your many accomplishments, Ashley Sanderlin.
Thank you. My name is Ashley Sanderlin, and I'm really happy to be here. I thank Dr. Bouzouki for that beautiful introduction. So I'm very pleased to be with all of you today to tell you about my research that is related to Alzheimer's disease. And so Alzheimer's disease is a field that I'm very passionate about. It affects millions of Americans, including my own family. And so that has led to my interest in Alzheimer's disease from a very early age, starting in high school, to undergraduate education at Bowling Green State University, and now to be able to study it as a PhD student at Michigan State. I'm very excited about this field and the work that I've been able to do. So we all know that Alzheimer's disease is a devastating illness, and it affects millions of Americans across the United States. One of the things that is most important about this disease, we see it in the news and the media, is that we're trying to increase the awareness of the disease. The disease is very prevalent, but yet it is not one of the most funded disorders that we have in our country, behind cancer and HIV research. And so in 2014, President Obama increased the funding for Alzheimer's disease to where now it is at its all-time high, but even still, we do not have the funding that puts it on the same playing field as other big disorders, like we just heard about the many different opportunities available through cancer research. And so research in Alzheimer's disease is focused on helping us to understand what the development of the disease looks like, what is going on in the brain. Excuse me. And so a lot of the research interventions that have to deal with Alzheimer's disease are taking a shift now to looking at early stages of the disorder for us to better understand the disease, because we now know that once a person is diagnosed with Alzheimer's disease, there is no cure or effective treatment. And so we know that the Alzheimer's disease neuropathology begins 10 to 15 years before clinical symptoms of dementia are present. And so there is this transition from normal cognition to mild cognitive impairment, which proceeds on to Alzheimer's disease. And so my research study focuses on that transition from MCI to Alzheimer's. there are many factors that are associated with the progression that we're looking at now in these early cognitive impairments to hopefully better understand what is causing, what are the causes or developmental processes that are taking place prior to full-blown dementia. And so as I mentioned, I study mild cognitive impairment because these individuals are at an increased risk for the development of dementia. And so we want to be able to look at factors in this group to see how we can assess what parts of the pathology of the underlying dementia may be happening early on, because in early stages, there may be a way for us to introduce interventions or treatments. So, to talk very quickly about my 6 years of dissertation research in 3 minutes, I'll give you an overview that's pretty general of what I'm most interested in. So I came to a place where in reading the research and looking at the different information available for mild cognitive impairment and Alzheimer's disease, I became interested in weight, mainly obesity, and its effects in the brain. There's a lot of research that shows that in middle age, people who are obese are at a higher risk for developing Alzheimer's disease later in life. There's also evidence that the behavioral changes in mild cognitive impairment predispose a person to developing a dementia. So we know that obesity and behavioral changes often occur comorbidly across age groups, but there's not hardly any evidence about these two factors in MCI. And so that is where I identified a gap in our knowledge and have focused much of my research on understanding these two factors. So, weight and behavioral changes. I want to know specifically what is the comorbidity of these two in MCI? What are the neurological signatures of these in the brain? And then also, how do they influence the progression from the mild cognitive impairment stage to Alzheimer's disease? So I'll talk quickly about the techniques that I've used. I've used the MSU Cogent Lab, which is Dr. Bouzouki's lab. Her database has been collecting neurological and neuroimaging data since 2005. So we have information on MCI subjects through the neurology clinic here at MSU, and I've been able to conduct studies to measure neuroimaging changes looking at gray matter atrophy and white matter connectivity of the brain. I've also used a large database called ADNI that she mentioned, the Alzheimer's Disease Neuroimaging Initiative, to validate and expand our MSU sample in this much larger data set. So, what have I found? Overall, what I found is that obesity and neuropsychiatric symptoms do occur comorbidly in mild cognitive impairment, and there are specific signatures of gray matter atrophy and white matter structural changes related to weight in MCI. Currently, the longitudinal data that I'm analyzing to see how the changes over time, whether or not weight or neuropsychiatric symptoms affect the progression of the disorder, are still underway in analysis, and so I'm working on those. And so with that, I will conclude, and I would like to thank the many agencies throughout the graduate school that have helped me with my research, mainly the Alliance for Graduate Education and the Professoriate Program, who has worked with me and allowed, through Scholar Awards, for me to travel to national conferences to present on my research throughout the last few years. The King Chavez Parks Future Faculty Fellowship has been a tremendous support in providing funding so that I could focus this final year on writing and submitting my work for publication, as well as the graduate school in general, who's been a great support to me through workshops and seminars. We have a lot to offer here at MSU that many other universities are not offering students to help with their advancement. So, thank you. Any questions?
You got underweight, you have body mass index.
Yes.
That's different from weight, isn't it?
Well, we measure obesity via body mass index criteria. That's the criteria we use to determine who is obese, normal weight, or overweight. Yes. It's not a perfect scale, but it's the scale that we use most. It's used most widely.
It's very stringent.
Yeah.
Yeah. It's not forgiving at all.
Other comments, questions? So I'll ask you the 10-year question. Outside of being a mom to an elementary school child and having to work and balancing all that stuff, what would you like to be doing, and what would you like the contribution to be?
My contribution, I would like to be in academia. I would like to continue this research, but also balance it with teaching. I really enjoy working with programs such as the Drew Scholars Program, the Summer Research Opportunities Program, SHROP, that is every summer I work with them. So I want to be able to engage with students as well as to continue on doing research such as this. So I see myself as a professor at an institution.
And what would you imagine, if you could wave your magic wand, would be your big breakthrough in research? What would you?
I think it would be really understanding how metabolic disorders such as obesity and type 2 diabetes affect the brain. How fast does it affect the brain? What is the pathology that is associated with these disorders and the neurological changes that we see down the road? We really don't understand that. And so understanding how metabolic disorders interact with the brain and then cause future cognitive decline.
Can help us with prevention?
No.
No?
No. Well, that can help us with prevention if we understood that.
Yeah.
Yes.
Thank you very much for being a Spartan.
Thank you.